And so quick agenda, if you haven't already, please introduce yourself with your name, and if you're with a CPA, your CPA in the chat, say hi to everybody. This is meant to be a friendly group and relatively informal and a time for discussion. And so please, if you have questions as it comes along, drop them in the chat. We'll do our best to answer them during the meeting. I'll keep an eye on it and I'll read your question out loud, or if you're willing, I'll ping you and you can come off mute and talk. And if we don't get to it, we'll do our best to get an answer to you as soon as we can after the meeting. So as a quick agenda, we're going to go through more information about the new home study process with Amber and Sonia. Then David and Kevin from IT are going to give us an update related to confidentiality and the online portal. And Matt and Renata will give us some updates for the online portal, new functionality. Debbie will give us some training updates, and Jason will give us some communication updates. And so with that, Amber and Sonia, are you guys ready to rock and roll?
Always ready to rock and roll.
Okay, here you go.
You.
You just tell me, I'll advance slides for you unless you want to take them over. You let me know.
I'm a fan of you doing the slide changing. Thank you. Okay. I was looking to see if I could see Sonia's face. And I don't see it.
Looks like she's calling in by phone, Sonia, but it shows.
There she is.
She's here.
Hey.
I'm here. Sorry, went right from one to another.
Thanks for coming, Sonia. Okay, well, we can just go ahead and dive in. Hello, everyone. I'm Amber Salzer. I use she, her pronouns, and I'm coming to you from Tumwater today. So I'm occupying tribal lands of Nisqually, Coast Salish, Squaxin Island, and Cowlitz. Without further ado, Sonia, do you want to go ahead and introduce yourself? And then I think the next couple are you.
Sure. Yep. So I am Sonia Stevens, and I am the licensing division research and methodologist. And this presentation is actually part of the work that I got to do. So I'm pretty excited this time I get to talk to you all. So without further ado, let's just move into the indicators and get started there as my brain starts to transition into this topic. Anyone else have one of those days where you like have 3 different topics back to back? Okay. All right, so indicator study methodology. So we actually decided early on that we wanted to look at a way to help us focus these indicators into more useful information individually rather than this one-size-fits-all model that we've had. Like, you know, we ask the same questions of everyone, we dig just as deep of everyone, and is that always necessary? So we wanted to run the study, and what we did is we did a case review study, and the people who helped with the study, we had 15 supervisors, all our area administrators at DCYF, and also 15 licensors across the state. So we had approximately 50 people help with this review because we also used our CQI staff and myself who reviewed some home studies as well. So we had a wide variety of perspectives and input. Our sample, we pulled 200 case studies out of family. So they had to be loaded in family. They had to be newer than the recent rule changes of 2013. And we wanted to make sure we had a representative sample of both CPA licensed homes as well as state licensed homes, as well as kinship providers and general providers. And then we also specifically looked for a sample of those home studies that were denied from licenses that had been revoked. And we included those into the sample as well. So we had a really wide variety of different types of home studies and outcomes to look at. And then what we did is we asked these folks to read the home study front to back and write down every theme that they could find and record it onto a worksheet. And it didn't matter what the theme was. It could be, you know, child of 4. It could be they had a dog. It could be live next to a road. There was some adverse childhood experiences, smoking. It didn't matter what the theme was, just everything that you saw, write it down. And then lucky me, I got all 200 of those back, and I got to put them into an Excel spreadsheet and begin coding that information. So I was able to identify some themes. I coded them 3 times, and then we triangulated those with the outcomes. So we took the themes, and was it a positive outcome? Was it approved? Was it, had they been licensed a long time? Did they have a licensing violation later in their license? Were they revoked, denied? What happened in that with that family? So we were able to run some statistics off of those numbers and identify those themes that were most predictive of negative outcomes, so denied or whatever, as I said. So let's go to the next slide, and I'll show you what those are. So if you have any other questions or you really want to dig into the science of this, we do have a paper on it. I'm happy to share that if you're nerdy like I am and really kind of want to know what those methods and which statistics we use. Be happy to share.
It's a great paper.
I
endorse reading Sonia's paper. So
it's not just mine. Amber helped to write it too, and a couple others. So I just want to put that out there. I also want to say that we did contract the analytics out to a neutral third party. We thought that that was probably pretty important. This is a very important process, and we wanted that expertise, so we did contract that out. So if you want to go to the next slide, Marina, then I can say the outcome. So we had a total of, I think it was 21 indicators. We ran the statistics in 2 different ways. First of all, was there statistical significance to those indicators when they were mentioned once within the home study? And then we were also curious about repeated indicators and patterns of indicators, like 2 indicators that interacted together or themes that potentially would have been more significant. So I can say that we didn't find any patterns that emerged as significant, but we did find 6 of those that were repeated were significant, and those are the gold there on the right hand of your screen. So these are the themes that if they were mentioned more than once in a home study, they were significant. The purple are those that were significant very specifically to the general population, general home studies. Those in blue underneath it were, oh no, I'm sorry, purple was universal. Amber's probably glaring at me like, purple was everybody. That was significant to all the home studies that we found those themes. Blue is very specific to those who are generally licensed, and red was those for kinship providers specifically. So you can see there were 21. You'll notice that the religious affiliation is crossed out, and while it was identified as a significant indicator, it's one that we are opting not to use in the home study. These codes are not going to be built into the home study, the acronyms and the words, so don't need to memorize them. It's really for us on our back end on the data. So yeah, if you have any questions about those, give you a second to look at them. It was a very interesting process. I will say here in this particular thing, when we're looking at indicators, these will not ever be used to approve or deny a home study. These were built on multiple layers of input and biases. So we can't really use them to say yes or no, but what they will be doing for us is telling us where we want to dig a little further and ensure that mitigation has been done. So yeah, anything to add there, Amber?
No, you did great. And I saw a question that says, can you tell us what the colors represent again?
Yep, I saw that too. So the purple is that those were representative of all home studies. So it didn't matter what type of home study had been done in that case. Blue was very specific to those home studies for general licensed, and red was for unlicensed. Gold was for when it needed to have been repeated, so mentioned more than once in the home study before it became significant. So for example, I'm gonna give you an example on that one. Medical needs is my favorite one. It just seems like the easiest one to explain. So someone might have mobility issues, but in of itself, it might not have triggered a reaction in that home study. but when it was paired with something else, like a heart condition or diabetes or something else, it raised the significant risk level, so it became more important.
I was waving
Okay,
at
so I'm
kids,
trying to
sorry.
think
Okay.
how will they be used, if at all, once the family is licensed and subject to CPS or LD intake referral? At that point, CPS and LD referral is a whole different set of regulations, and so we can't use the same indicator research there as we would in the home study. So I can say that I would be very interested in continuing that research into our regulations, and we're not there yet. So. So I guess the answer to that is they're not used at all during, it's just in the home study. It's not about the regulations. Any other questions? Okay, then I guess we can go to the next slide. Back to
That me?
Amber. Uh-huh.
All right. Okay, so the alignment. This is a look at the flow of the new home study, and you might find that it looks similar to the flow of the current home study. So a lot of what is built into the framework that Venti is building for us is from the home study guide. So these are the sections and not all of the subsections. And they flow like if you were to be reading it's like a book, top to bottom, left to right. And I like to consider this a good point to share how so many people contributed to these. So the language like used within the home study, the titles and the sections and the subsections, we're all open to feedback far and wide, and it is pretty neat from like where I'm sitting to see like some of the changes that were made based on other people's feedback. And if you were someone who gave feedback and don't see that reflected here, you're welcome to reach out to me about that. Now or probably later would be better. So these are how it aligns. And then Raina, let's go ahead and move to the next slide. It's about the organization and flow of the home study. So some of the goals are to highlight the most used information up front. And what I will do today is kind of walk through what those sections are going to look like, what's in each one, not literally what they were going to look like. So if you're a visual learner, it is mostly just words here today, but feel free to jump in and ask questions as they come up. I will welcome the break in hearing myself talk. So highlighting the most useful information up front, reorganizing the content so the information is collected in only one place, providing methods and guidance for the assessment to gather additional information only when needed, not always, and then allow methods to guide and record when mitigation or mediation is needed. So those are some of the goals to this rebuild. And let's go ahead and move forward unless anyone has questions there. Okay. So front and center, when I said that the most useful information will be located up front, this is what you see in the beginning: the demographic information, applicant, household, others residing on the property, background check results, just kind of a brief snapshot. So if you're not the person who is out meeting with the family and you're reading the assessment, it gives you a good idea of what like you can expect versus now, like if you're reading through a home study, you might find out about the other people who live on the back 40 when you're on page 5, right? Versus in the beginning, it's kind of like, this is what you're going to expect to see as you read through it. It's not a genogram. I know someone had mentioned a genogram and I love that idea, but it is at least front and center. So that is where it starts. And then let's go ahead and move to the next slide. And here's where I'm basically going to just walk you through that slide that had the alignment list. It will have like the topic and as well as like where things fall within the home study assessment. So as we move through, you'll also see that the indicators are noted on here. So They're like strategically embedded within the process. So when you're working through it in Menti, you're not going to see child trait requests. You're going to just answer questions and then work through it. But this is to show you where they're at. And I also kind of did this for my own brain as I was adapting to this new piece of information. So the first section is motivation, kinship, general, growing family, other, with space to write in what that might be. It's child preferences, but that's the old term. So the shift in the new home study is it's going to be children and youth we serve. So a little bit less about like what kind of child do you prefer to provide care to, and more about like these are the children we care for. So how can we help families adjust to that sort of thinking? And then the indicator here is child trait request. So I'm not going to go into a lot of detail around all of these because there just isn't time. And this is just meant to be a general overview. So, all right, thanks, Marina. Next section, background, family facts. So starting with where the applicant was primarily raised and by whom. And then there's some like guided information throughout the assessment as well, because not everyone has a place they were primarily raised. Like, what if you had a parent who traveled for work or a caregiver who traveled to work and you moved all over? But those are considerations that you'll write out in your narrative. And like, even if you do, or if you grew up in a family where you traveled a lot, you might still have somewhere that you consider like your primary place of where you're raised. So I just mentioned that because I know sometimes like we have reactions to how things say or are read. So okay, so information about the family of origin, including mental health and addiction history. And then the next sections are, oh, I'm sorry, Marina, would you go back one more or go back to the last one? So childhood trauma and adult trauma. I wanted to mention that a shift here is where the background family facts are. So here's where you talk about the family of origin. So right now, if you're talking about the background family facts and you are talking about I grew up with 3 caregivers, grandparents, and a single caregiver. And one of them had a mental health issue that impacted like my childhood growing up, and it impacts how I parent today. So you're going to read about that in this section, and then you're not going to read about it again in the mental health section. So right now, some of our work is a bit redundant, right? Because of how it's set up, and people expect to see it in multiple places, or sometimes soups, or the state might return the study to you because they want to see it in all those sections. We're trying to get away from that. So when I said earlier about reducing that redundancy, this is what I mean. Okay, go ahead, Marina. All right, next section, caregiver outlook and health. So this is health, all health. There are questions around different types of health, but we're including mental health here instead of calling it out specifically because it's not, it doesn't need to be further stigmatized, right? It's overall health. So this is also where drug and alcohol use lands, and family planning. And then the indicators here you see that fall under these sections. Should probably glance at my notes, right? See if there's anything major I'm missing. Okay. Let's go ahead and move forward, Marina. So relationship history. This is about all the relationships. So not necessarily the amount of emphasis we have currently regarding like if you're in a partnership or a marriage, but all the relationships, right? So of course, if you're in a partnership or a marriage or dating, that's important. And all of the other relationships we have in our life, like what do those look like? And how do those relationships work? What do your boundaries look like? How do you argue? So some of these questions are going to be built in to help like guide through the work and then help with consistencies too within the sections. This is also where intimate partner violence and domestic violence lands. Okay, next up is the indicators. So there's kind of a lot of them for relationships. And I know one thing I probably have said ad nauseum is, to me, this makes sense because relationships are a huge part of being a human, and they're a huge part of raising children. And so when you consider how the study was done and the work that we're doing in human services, I think it does make sense that a lot of indicators land within this section. So I know Sonia said this. I think it's really important to not say enough how indicators are not negative, or positive. It's not one or the other. They're not mutually exclusive. It can be both things. And probably all of you know that because you're doing this work, but I just want to make sure I point it out because we want to just keep that kind of at the forefront around the use of these indicators. So, okay, next section, please. So, personal characteristics. Here's where we talk about experience with foster care, guardianship, or adoption, goals and values, and any potential conflicts between the applicants. I don't know if any of you experience, but if you have a partner whose 5-year or 10-year plan is a little bit different than yours, that can result in some conflicts, right? And you have to figure out a way to resolve that. So here's where education, supporting a child's religious, spiritual affiliation, diversity and inclusion, and parenting experience land. Educational success here as an indicator is more about how you're going to support a child in their education, whatever that looks like. It doesn't mean that your education is going to indicate what kind of care you're going to provide to children. I realize as I'm talking through this that I'm playing with this like little fidget toy. So if it's snapping in my microphone, can I get like an awkward high five? No, just kidding.
I can't hear it for what it's worth, but fidget away.
I'm fidgeting, right?
Good modeling.
Thank you. I'm also, well, sorry. Okay, discipline and guidance. So this next section is about present. So discipline and or rewards, what you're using if you're already parenting, what your planned approach is if you haven't or you're not parenting currently, experiences you had as a child, how were you disciplined and or guided and rewarded, and what was your takeaway from that? Was it effective? Was it ineffective? So then in this section also falls like chores and routines. And then the indicator is inappropriate discipline. Okay, next up is physical and social environment. Oh, good. Sometimes, we look at these slides a lot of times. Maybe some of you have seen them before. I don't know, but things landed where they were supposed to. Huzzah, Debbie and her team. So home elements, home safety, hazards, pulling out the highlights. So like some of this new home study build is about like trying to not take away narrative, but shift it to be more consistent. And so we'll maybe take a little bit away, right? Like in this home and neighborhood section, sometimes you'll get pages around like what the home looks like. And when you walk in the front door on the left, there's the TV, and on the right, there's a piano, and all, sometimes like really beautiful writing, but not always things that need to land here. So within this is the indicator around home and community safety. And one of the things that we talk about is like how you use your own lens when you come into a home. And so trying to take the bias out of that. So not coming in and assuming that because maybe it doesn't feel safe to me, that it's not going to feel safe to a child, because your idea of safety might be different than my idea of safety. So trying to keep this as objective as possible. Okay, next up, occupational history. So we have employment, current occupation and work schedule, relevant employment history, anticipated childcare plan to include like an emergency plan if needed, what the transportation plan looks like, and military experience if applicable. And then the finances. So if you're a kinship care provider, how do you plan to support additional children? If you're applying for general to care for kids that you don't know, how are you already meeting your needs and will be able to continue to do so without the support of for the system, foster care, etc. The indicators here are military and then financial work, unstable and stable. I like to point out here with this military one because it's kind of a, we don't know why yet how things landed the way they did, and that's where validation studies will come in to help with that. But military, just like any of the indicators, could be positive, negative, or both. So when you're moving through this work, someone in the military may have experienced like direct combat, and they have a TBI because of that. And that means that they've had to learn new ways to function on the daily. And it could also mean that they have a strong commitment to their community and a respect for routine and structure. And so there's like both positive and negative, I guess. I'm just trying to give that example so you know what I'm speaking to when I'm talking about all those things. Okay, next up. Supporting documents. So this is a section to show some more specifics around references. So like reference when received, related, unrelated, general summary. And then supporting documents, like if you have additional documents that you're using for mitigation or maybe to help you get to that final approval for a family, then you can summarize them here. So the adoption requirements, you might list them here as well, but that comes later in tier 4, which we already talked about in this group, I think last time. So, okay, and the indicators here are resources available and unsupportive references. All right, so last but not least is the evaluation. There's 2 slides for it, and it just bullet points kind of what we, or in generally what you're already working through when you're completing an evaluation for a family. And I think it'll be a bit more like bullet pointed like this. So like summarizing strengths, concerns, areas of improvement, and then moving through each of these bullets, which I won't read to you, but give you a moment to read through them yourself. Okay, and then Marina, probably you could go to the next one if you think it's been long enough. And the indicator here that lands at the end is applicant cooperative. And I know, Sonia, you can probably speak to the science behind this one some more, but I consider what it might look like for a family to be moving through our process. I actually consider about it like myself, you know, and like how invasive this process it is. And like, there are times where I might not be cooperative. I'm a little bit that person where I'm like, tell me why you need to know that and tell me what exactly you're going to do with it. And then I'm going to think about if I'm going to get it to you. But that doesn't mean that like someone's not going to be able to move forward or do an amazing job taking care of kids. And so again, if you haven't caught it enough, it's probably the 4th time I've said it, right? Doesn't necessarily indicate something negative or positive. It's all the things in our holistic assessment. Okay, so last up is on the back end. It's the recommendation and how these assessments align with the tiers. So the recommendations look like well-being assessment completed, license requirements met, adoption requirements met, and then not recommended for placement of permanency, which would equate to the current day language of denial. And then there's ICPC specific language. So I don't think that's very common for CPAs, but it is built in there. And then the appendixes around legal permanency. So where you are confirming that you've had the discussions around the 6 core concepts of adoption. Contingency planning is not only a tier 4, contingency planning is in all cases, right? What's your plan? If something happens, you can't take care of your kids. You know, I think about my plan all the time. What's your plan? No, just kidding. So that's it. I know I talked really fast. I was trying to kind of, you know, get it all out there to you, and I will just pause, look at the chat. No,
We had
that it.
a question a while back
can-
that was, what if someone wants to read your paper? How can they get it?
Marina, do you still have it?
Do I still have your
You could
paper?
share it. Yeah.
Okay.
You could share
All
it.
right. I will-
You can share it. That's the advantage, right? You have it. So in the chat, there was a question about the indicators and how they would be use the assessment. So yes, Nicole, thank you for that question. It's just asking more about supporting documents and how will that inform the assessor. So that's exactly, you're thinking right along the lines of the indicators themselves. So if we notice that they're somewhere in the assessment, we either observe or in some of the documentation, we see that there might be a medical issue. It could be that the person doing the home study would want to ask for a medical report form from a doctor as part of the mitigation strategy. And they absolutely can ask for it. In the home study, it says, you know, it'll ask, was there a medical need identified? And you would say yes or no. And if it's yes, how did it get mitigated? And it might be that that's the mitigation strategy, is to get an all clear from a doctor, right? So you could do that. All of those are listed out for different strategies, as well as another option in case we miss something. But yes, we would ask for that documentation to be pulled in then if you see that an indicator had been triggered to that assessment process. However, if medical needs was not observed, you did not find anything else in that, we do not have to ask for that medical form, right? So that's the differentiation, right? We don't need it. Didn't assess that we need it, so we don't need to go get it. I hope that answers a little bit more.
Great. Any other questions from the audience? Either you can put it in the chat, or if you'd like to raise your hand, we can have you pop off mute. And for anyone that didn't see in the chat, yeah, go ahead. Sorry.
I was just to say the second part to that question, and you and Amber could probably answer that one quite well, is that are they going to be revamping the forms?
Is there a revamping of some forms? Oh boy, is Renata here today? Yes, forms will be revamped, all in a positive way. At the very least, revamped so that we're not ever, even if it's somebody's name and address, like you're going to put that in one time and it's going to carry over. And I know Amber has worked particularly hard, and Renata has as well, on making sure that if there is something that's on a different form, that it's carried over to subsequent forms, so that you guys are focused on high quality work and not the low quality work of, multiple data entry. Amber, feel free to add color to that though.
No, you said exactly how I would have said it. I'm like, where's Renata at? She deserves all the credit. She's been working really hard on moving.
So hard on this. Yeah. Great question though. And the slides will be available in the notes. We'll make sure that the link is out, because someone asked in the chat about sharing this information with their colleagues. And this is for those of you that didn't join us last time, this is the second of 3 parts that Amber and Sonia are going to be doing on the home study. And we'll make sure in the notes for this meeting to share out the slides and notes from last time when they gave an overview of the 4 tiers. And I don't know, Amber or Sonia, do you want to preview what you'll be doing next time?
Well, I like that suggests I know what I'm doing next time.
Sorry. Okay. I didn't know, so I thought maybe you would know.
I take really good notes, and I monitor my calendar weekly, but I don't know what's coming next month.
Okay. Well, it will be deeply interesting content, so please come back next time for more about the.
Absolutely.
And I know this is a lot to digest, right? Especially if it's one of your first times hearing about it. So please, if you have questions, you can send it into the email. We can cover it next time. We'll find ways to get the information out. This is by no means the only opportunity to discuss this and learn more. But if I don't see any other questions, if you think of one as the rest of the presentation goes on, drop it in the chat and we'll answer it. But in the interim, thank you, Amber and Sonia, very much.
I actually have a question.
Sorry, go ahead, Trisha.
This is Trisha from Amara. Following up on kind of how the indicators are going to be unearthed in the first place. And I got the impression from what you said, and I want to make sure this is right, that it's going to land on the practitioner or the assessor to be asking the right questions in the first place. Or is there going to be some, questionnaire form that gets answered that kind of gives us a chance to understand where we're going to need to dig in? Does that make sense?
Yes.
Yes. Hi, Trisha. Yes, it does make sense. For sure. Sonia, do you want to go first?
Well, and I was just gonna tell Trisha yes and yes, right? Like they're both existing. So the home study questions originally are already designed to be able to make that assessment at the end of each section. And at the end of each section, there are going to be specific questions around the indicator as well. So the answer was yes to all of that.
Yes. I will only add that it's exactly as Sonia said, and the guide that's going to come along with this, which is an initial guide, because what I'm learning as we're moving through this process is things aren't always going to be exactly how I anticipated they would be when you're building something new. And so I'm kind of pivoting as we all are. And so there's like sections under each indicator that says to consider the application, the interviews, collateral, context, and documents before you answer the following prompts. So you're using your clinical skills as you're assessing and working with this family, and not just taking things at face value. It's like it's the assessment that you're already doing, so the questions will build you up to that. But if you're answering the question, it's not just like, well, it's all of those considerations is all I'm trying to say. And Jamie, I'm gonna answer your question on here because I saw it in writing, and I'm trying to sort through the chat, but I don't think I'm catching everything. So if someone sent me something privately and I missed it, very sorry. And feel free to email me afterwards. I can throw my email in the chat. Or first name last name at dcif.wam.gov. So around, is there, let's see, I lost it again. Is there, I think it was around if there were specifics about an applicant's ability to meet a child's cultural needs in addition to their other needs within the evaluation section. So I don't think that's a specific prompt within the evaluation section, but it is built out specifically in the child specific section and in the children and youth we serve section. So that is there within the assessment. So if it's eval there, great. Or if you want to add it later on, like hopefully it's going to be a strength that you're noting in your evaluation. But yes, it lives within the document, but I don't think it's specifically spelled out as a prompt under the eval. Not too late to add.
Thanks, Amber. And thanks for
I'm looking at that.
One more question was on if are these new forms available on the website? I think the answer to that is they're going to go live with our Binti, and you'll get to experiment with them as you get access to the Binti kind of test environment. Some things like the home study, they don't need to be on paper anymore, right? Because they're internal. External forms that are facing our families will always have a paper version because for various reasons, some of our families are not going to use the portal. But I think there's an expectation that all of the internal staff will use the portal. So you'll get to interact with the home study. And we'll get an update from Debbie in a few minutes about the UAT schedule and training. So thank you, Amber and Sonia. Again, if folks have more questions, feel free to drop them in the chat. And otherwise, I'm going to move on to David and Kevin from IT, who are going to talk for a few minutes about confidentiality in the context of the new portal. So David and Kevin, I hand it over to you.
Great, thank you very much. I lost my slide, there we go. So with Binti and with state system, we're going to have some stringent requirements for storing and transmitting data for both the agency users and for applicants. A lot of the data that's going to be in Binti is considered level 3 protected health information, which is individually identifiable information for the users. And that includes things such as social security numbers, names, and things like that. Office of Cybersecurity within our agency is actively involved with us to ensure that the system meets standards for security. Users will be entering securely through the SAW system. And we have Dustin Butler here to give a quick demo on what SAW looks like and how users will access that. So they will access Binti via SAW, and Binti also provides their own security. So the data being transmitted, the data being stored is all done securely, and we're meeting the highest levels of security for those things. And you mentioned confidentiality. I don't know if you meant security on that or there's some specific issue related to confidentiality.
Yeah, I think your definition works for addressing confidentiality,
Okay.
just helping everybody feel
Okay.
reassured that IT is on it and is totally about protecting the data.
Right.
So
Cybersecurity is really actively involved. They're doing reviews of the systems. Our vendor will provide verification that they meet all the standards, and we should have a pretty secure system once everything's up and running. So if Dustin is on, he's going to do a quick demo of what the SAW registration and login looks like.
Sure, yeah. Can you hear me?
Yeah, Dustin, we can hear you.
Great. Let's see if I can share my screen here. All right. Are you seeing a Chrome window here?
Yeah, with Google, the Chrome just hung on a homepage.
All right, so I'm going to demo our background check application in our LoRa environment. So you can see here, and it uses our SAW integration. You can see here I'm going to a background check portal application, and you'll see I won't actually go to that application. I get redirected around, and I end up at a SAW login screen. I have my login set up, and so 99% of the time, this is what people will see. It's just they'll do their username and password that they already have registered, and we can do the registration here after. And then you'll get to choose which form of multi-factor authentication you want to use, whether email, or I also have my phone set up so I could do a text message. So I'll go ahead and do email. Hopefully it's not just my window. You'll be able to see the email here. And it kind of has some two-way verification here. You can see the codes line up there. So then once I copy and paste that in, I'll get into my application, ask me if I want to remember my device. Usually I just skip through it. And then ultimately we will end up back in our background check portal application. So that's the login process, pretty straightforward, typical, I guess, besides maybe the multi-factor is a little different for some people. So log out, you can see it redirect me back around, and what it did is it actually took me to the home page where I needed to be authenticated again. So that's why I went back to this file page once I logged out. So we can try to look at sign up here. Let's see, I need to be a little more original here, I think. Be less original, I guess. So the email needs to be your email. So if you're doing any testing in the future, you can have multiple accounts under the same email. So something to note there. Let's see if this is taken. Got to find some tractors here. Looks like it. Right, so if everything went smoothly here, I should have another email at some point that's going to basically make me click on a link as long as I didn't use my personal email on accident or something. There it is. So you just click here to activate. Go ahead and click login. Hopefully we will see. It should ask me, yeah, so it's going to ask me to do my multi-factor authentication. And again, same kind of process here. So this application is a little different in that we kind of intercept it at this point and make the user go through a custom mapping step, but you won't necessarily see this. But regardless, normally you'll just go right back to the application. So that is that. That's all I really had.
Great, thank you. And
Sure.
one of the advantages of this, a lot of people may already have a SAW account if they have an SSPS account, Department of Licensing, if they signed up for Our Kids mobile app, any of those things, they probably already have a SAW account, so they won't have to create another one if they don't want to. They just be able to log in through SAW directly to Binti.
Great, thanks, Kevin. Anything else from IT? Kevin, I think you're muted.
Oh, no. David, did you have anything to add?
I do not have anything to add. Good job, guys.
Great, thanks, Kevin. Thanks, David. Appreciate you. And thanks for the demo. Next, Debbie, or sorry, Matt and I think Renata's off today, but would you like to pop into the online portal highlights?
Sure. How much time do I have? Just a few minutes?
You have, let's say, 8 minutes.
Okay. Perfect. All right. I'm going to share my screen here. All right. I hope everybody can see the Binti dashboard.
Yes.
So I think we have spent a few minutes just kind of running through some of the visuals and trying to give you a sense of, you know, where things may exist in the program. So today I want to highlight a couple things that are new and different, and that includes the renewals. There used to be only one row of data here on this dashboard, and it was under the category of initial. So now the renewal track is listed in here, and so this is how you would track families that are pending renewal. And just going to focus on a couple things. Since I only have a few minutes, I don't want to spend a lot of time. At a future one, I want to show more of how the home study and the well-being assessment will show in the system. But for now, let's talk about how an application gets entered into the system. There are two ways an application comes in. One is you provide, as an agency, you provide the applicants a website to complete their application and their documentation in. The second way is you do it on their behalf. And that's done through the terminology up here called intake family. Intake may mean different things to different people, but in this program, intake means I'm going to put a family into the system. So it brings us to a page where we will enter the pertinent information on the family, which is very similar to the application form that we would have filled out in, well, we still do, but in non-paper world, we will use this. So there's an opportunity to do all the things that would normally be part of it, plus an additional set of tasks in here. So you can create your assignments. You know, we can create our usual assignments, however you would do it in your work, including your supervisory assignment. And you can actually do up to 3 assignments per field. So the approval worker is actually the case carrying worker or the social worker or the licensor or whoever that may be. The support worker would be the supervisor or whatever role maybe a leader might have in an agency. So we get all that information in, and for the purposes of this one, I am going to use the opportunity to do a random population here. And then I say submit intake form. And it'll chug along for a second here. And this first row right here is the one that I just put in. So this particular application, again, it was random data, so not everything is going to be filled in, but here is the information about that applicant. Now, there is from within the program, not here in this exact spot, but from within the program, there is a place for you to send them a specific link that will then allow them to, using their password or their email, access the program to finish completing the process. So you don't have to do the whole process for them. You can just initially set them up and assign them. And then the remainder of the application can be completed by them in the program. And I think we mentioned it a little bit before, but I also want to point out in this program, there are case notes. So you can track your work, or a supervisor can look at items throughout this In our computer system in licensing division, we call them provider notes, but they mean the same thing. There are notes that you can create, for example, for contact. Let's say you had a contact with the family, or you had a supervision with one of your licensors about this family, and you can input that information into a case note. And I cannot spell today. And then that case note is there on the list. So I just wanted to highlight a couple things. I'm going to stop because I cannot see the chat very well.
Matt, there was a question a minute ago about if families will have an opportunity in Binti to review their home study before it's submitted for final approval.
Oh, that's a great question. So any document that is either created or loaded into Binti can be accessed as a PDF from the system. So you can pull the entire document or all of the documents out as a PDF and either print them or email them to the applicants for them to just review. If you're asking them, as a draft of the home study to take a look through that, you can do that by creating that PDF and then emailing it to them.
Great, thank you. And a related question was, how will supervisors provide edits given that it all lives in Binti?
So if let's say I create a document in Binti and I say, okay, I've done that document. Let's just say it's a licensing waiver. If a supervisor needs to make an edit or change it, they can change it and it will actually create a new document that overlays the top of that one. In other words, it is now the existing current document, but the prior document is not lost. It is not left. It is still on that list of documents for that applicant, for that family. So there's the ability to edit, add a new document, or add a same document, but you don't lose the existing document for record keeping purposes. And if it requires a signature, it will prompt a re-sign, whether it's by staff or applicants.
Great.
Is there, can I have a follow-up on that? Is
Yeah, go
there,
ahead.
so that sounds like there's a way to actually, change wording, but is there a way to provide feedback? Like, I don't understand, what you just wrote here. Can you expand on it? Something that's a comment, not changing the text.
Yeah, I think that at this point, I would say I'm still exploring that myself, but your best option might be to create that PDF doc of that task in there and then do your comments in there via the PDF and exchange that back and forth until you have a final. Again, we're kind of early on. We're just going to be doing some testing and stuff. So I'm not 100% sure if there's another way or not, but it appears that that may be the most likely solution for that.
Thanks, Matt. And then there's a question, when we set up a family in Binti, does the 90-day timeline begin?
So I think there's a lot of discussion around, what constitutes an application and when does it start and all of those things. The date and the timelines within Binti a lot of them are hard-coded and preset based on the filing of certain things. So what we want to try to do is match that to our practices as best as possible. We can't make some changes. In some areas we can change and we will change as we are able. But the timeline, again, we want to make those timelines so that they're visible and make sense to people. We want to make them match our practice as best as possible.
Got it. Thanks, Matt. If there's any more questions, I want to make sure we have time for Debbie to give some training updates next. So please drop them in chat and we will make sure to follow up next. But thank you so much, Matt, for giving the update. Debbie, can you please take over training updates and needs?
Very, very briefly. So thank you. And it's great to have everybody here today with us. Really quickly, what Amber and Sonia have given is a teaser. It's an overview. And so what I wanted to share, and we'll dive into it a little bit more in our months ahead with our meetings, is expanding this training to essentially a full day training. So we're going to be looking at July and August for our staff, our 4 pilot CPAs to be joining in with us for the home study framework. And then based on our, I'm going to say, soft launch date of November, September, looking at train the trainer approach. So we'll share a little bit more in the months to come, but I did want you to know there's
I think we lost Debbie, but I still see other people moving. I will try to be. She had some updates for training schedule. Does someone else, maybe Matt, feel like you could give that update? And if not, we can send it out in an email.
Yeah, I'm sorry, I'm not as familiar. I would not be
No,
real
you're fine.
comfortable committing to something.
I don't know what the dates are either, so I don't want to say incorrect dates. Okay, everybody,
Okay,
please. Oh,
Yep, this is, sorry, this is Marge from the Workforce Development Team. There are no dates yet, and we're in the process
Okay.
of getting them finalized.
perfect. Thanks for the update, Marge.
Yeah, you're welcome.
Okay, and then I think the last update was going to be Debbie playing Jason on TV to give a communication update. And to share, I believe that the broken link from last time that we discussed is now fixed, which is good. And then I think we've made some progress on posting recordings of past meetings.
Okay.
But I'm not Debbie playing Jason. So maybe Marge, do you have a good update on that?
I don't, no, not at all.
Okay, we will absolutely
Sorry.
send those. No, you're fine. We will absolutely send those in the meeting updates as well. So we have 3 more minutes. Would anyone like to ask one final question? Corey is wondering about the slideshow and the Lego slides from April's meeting. So if that is not posted on the website yet, we will make sure that it is, but they should be.
Marina,
Yep.
Marina, I think that by the 9th they will be posted.
Fabulous. Thank you, Nick. Okay, by the 9th, Corey, they will be posted. Okay, well, I apologize for our minor technical difficulty, but we will make sure that the slides, the recording is posted. If there are any remaining questions in the Q&A, we will make sure that they're addressed. If you didn't get a chance to introduce yourself in the beginning, please make sure you drop your name and your CPA in the chat before you leave so we know you were here. And short of that, we appreciate everybody for coming and thank you so much. Have a great rest of your week.
Thanks, guys.